Hello and welcome to another edition of The Nation. I'm Gerard Ratnam. Today we delve into gastro problems during Ramadan. Joining me in the studio is Dr. Prabhjot Singh Sidhu. He's been here before. He is quite a star on the internet. He's a consultant gastroenterologist, listen to this, a hepatologist and an internal medicine specialist. He joins us once again. Prabhjot, thank you very much for taking time off. I'm guessing you're coming just after work.
It's given, isn't it?
Busy man. Yeah, busy man given the Ramadan season. Do you see, is there an uptake in patients during Ramadan?
Two main things that happens is the people that before Ramadan start, they come in and they're worried that, oh, my stomach pains, my reflux, is it going to get worse? What do I do? Can I fast? Can I not? What? How? And then the next thing is when it starts and the symptoms get worse. And then, so a certain group of patients do come up, particularly those fasting.
Right. So with Ramadan now, I guess the thing we want to talk about is gastritis, GERD. We also want to talk about dyspepsia. But where do we actually start? With fasting, some people can, some people can't. But because it's an obligation towards religion, everyone has to do it, or at least try to do it on a yearly basis. Now, what are the things I have to be careful of before I commence a fasting season?
If you are otherwise well, nothing. Just follow the rules. When you break fast, don't overdo it when you eat and so on and so forth. But if you have issues, if you have gastritis or reflux, the first thing to understand is that your body produces gastric acid when you see food. If you don't see food, it doesn't.
Right.
So effectively, during Ramadan, your gastritis should be better. But the inverse is true with reflux, which is GERD and heartburn and things. People call it all sorts of different things. So what can you do? You have to prevent it. So the easiest thing to do, we break it down into, if you've got gastritis, and you're on medicines, fortunate thing is the medicines timing are such that you are actually having it outside of the fasting period. So stick to your medicines. Don't skip it, whatever you do. The other thing is that when you're about to fast, you want to avoid hunger. Meaning, don't eat simple sugars and things that you're going to be hungry very quickly. Have things like oats, bananas, and fruits and veg and things like that. They will sustain you a lot longer. The hunger pangs won't be there. Your stomach will feel full longer and less chance of gastritis. When you break fast as well, don't go for something fried. Don't go for something spicy straight away. Start with some water, dates, and gradually build up, small and frequent. The idea when you break fast is not a permission to just eat all you can.
Right.
And this will also help for someone who's got reflux disease, because your stomach's empty. The minute you put everything in there, it's going to fill up and there's gas build up and so on and so forth. You're going to have a high chance of reflux anyway.
Let's dial back a little bit and talk about people who eat late, saying if you have to eat at 12 or 1 and you end up eating at 3 and you say, oh God, I've got a terrible headache, tangkap kepala, we call it in Malay. What does that mean? Angin?
Yes, pretty much.
What does it mean? What's happening in the gut that it gives you a headache?
Well, it's not really a headache because of the gut. It's how your body responds to it. Look, if you got inflammation in your stomach for whatever reason, you got gastritis, you're going to generate gas. You're going to feel like you have a balloon in your stomach.
Right.
It's going to fill up with it. Anytime you put anything in there, you're going to it's going to get even tighter. So it's either going to be pushing it really tight if your valve is nice and secure, and taking a deep breath in is going to be a bit harder, and you're going to cause pressure going up and from the neck to the head. Now, another thing can happen is that if the valve is a little bit incompetent and you do get reflux, when it does reflux, it overspills, not really overspills, but irritates the top here, your body goes into a panic mode and you tense up and you get a headache there. Same thing can happen if you were even constipated, because it's just the pressure build-up. There's nothing wrong with your head. It's just the way a symptom gets transferred all the way to the top. So you see people with reflux and things, they complain about sinus problems, earaches, cough, a sore throat, sour taste, but no heartburn. It's the same sort of thing. That's what really happens.
So essentially, when you break it down, what is gastritis and what is GERD?
Okay, so gastritis, the gas bit, it's not actually gas, it means stomach really, and itis means inflammation. So stomach inflammation, so dyspepsia, so on and so on. Inflammation in your stomach, that's it. GERD is gastroesophageal reflux disease. You're allowed to have reflux, everybody is. But when it causes symptoms, disrupts your life and so on and so forth, needing medicines or maybe even not, then you call it a disease, and hence it's short form into GERD. Everybody likes the word GERD. It's just reflux, it's heartburn, it's all the same thing. GERD, or some countries GORD, whichever you do it. So, but the thing is this, most of them stems from a bad stomach. So you got inflammation in the stomach, pressure builds up, gas builds up, the valve gives way, things come up, and along with it, fluid, gas, whatever, and hence you get the reflux kind of thing.
But I guess here's the other thing, awareness or education with regards to this, because most of us think that it can be treated with medication, you can operate on it and it'll go away. You can't.
I always tell my patients, you have to find the source, the cause. Giving you medicines is going to get it better for a while, but if you're one who eats off time, you don't eat on erratic timing, infrequent meals, you take lots of painkillers, you got diabetes or kidney problems or too much alcohol or whatnot, it's going to irritate the stomach. Now, for as long as you don't treat that, I can give you medicines, you will get better, but it will definitely come back. So to find the cause is important, and once you're better, the education that comes after it is paramount, because I need to make sure you are well. You got better things to do than coming to see me in clinic, you know, and that should always be the goal.
Right. So if one is suffering from GERD or gastritis, they don't know what it is, they haven't seen a gastroenterologist before, is it easier to start a food journal, find out what you eat on a daily basis? What do I do at this point?
Just come to the clinic and tell us what you're experiencing. Don't be so fixated about whether you got GERD, gastritis, reflux. Don't worry about it. Just tell us what symptoms you have. Right. And that way we can easily explain your symptoms to you as to why it's happening. This is part of the understanding and what we need to do, if at all, to get you better. Now, that does not equate having a scope or endoscopy or nothing like that. Any test we do, the goals are still the same, is to get you well. Sometimes people need it, sometimes people don't.
Right, but shouldn't this be happening at primary care, healthcare level? You know, you already, you know, when people come to see you, they should be referred to you by someone in primary healthcare. You're a specialist. You know, when you come, people must have problems. So how is it that people are bypassing primary healthcare? What's happening there?
A few things. One, that they are just not getting better. Two, you know, they just want to go direct to specialists for whatever reason. There's nothing wrong with that. They should always come via primary healthcare, because the problem might be as simple as just being on medicines for a short while and there'll be the end of it. It's so varied as to why people come. Honestly, some people just they have no trust. Some people just, I don't want to see two doctors. I just want to see one and get on with it. I want a shortcut, and you know, the list is endless.
Right. We're going to take a short break. When we come back, we're going to discuss a couple of things. The first thing I want to talk about is, you know, colon cleansing, people using coffee and doing that. I don't know what that's all about. Of course, you know, when we talk about colon cleansing, we're also going to try to tie it in with Ramadan. Transnasal scope, do you know what it is? If you don't, stay with us. We're also going to come back and give you some tips as to what fasting is, what time is a good time to fast, so on and so forth, right here on The Nation with Dr. Prabhjot Singh. Stay with us.
Yang kami faham pakai mask.
Jarak mesti at least 1 meter.
Wash hand frequently. Tak mestilah pakai facial mask.
Penjarakan sosial. First of all, macam kita masuk mall kan, sini-sini kedai mesti scan.
Sentiasalah jaga doktor.
Kita jaga kita.
Kita jaga kita.
Kita jaga kita.
Kita jaga kita.
Thank you for staying with us right here on The Nation. We're currently discussing gastro problems during Ramadan. Also did promise that we're going to talk a little bit about transnasal scope. Apparently he's the best in the country. We'll find out. Also, what's this thing about coffee and colon cleansing? Like, what's the right term for it?
Call it almost anything you want. It's a colonic enema, colon cleanse. It just came and went as quickly as it did.
Right.
The idea was that you got toxins build up in the body, hence you clear out, you feel better. But the thing you should actually take a step back and see that when you have a proper bowel movement, you feel satisfied you've been to the toilet, you only empty 1/3 of your colon, not the whole thing. Your colon is there to absorb fluid. clearing all up is just disrupting its natural process. It was never done in the past, and somebody thought it was a good idea. You feel better, of course. You feel lighter.
Is there any science to back this up?
Hit and miss, really. Some will say yes, some will say no. Nothing solid. I'll put it this way: it was that good, we'd all be doing it.
Right. Okay. But there's a flip side to this, and I don't want to get into an argument here.
Yeah.
If you say it's a hit and miss,
Yeah.
it's the same thing that's being said by our guys who practice alternative therapy. They say, look, when you go to a gastroenterologist, he's just helping you, clear the symptoms.
Yes.
That's about it. So they give you medicines that reduce acid, also known as PPIs.
Yes.
They give you simethicone, things like that. That'll just doesn't cure you, but just alleviates the symptoms. So
I thought, no, that's not true, really, because as I said before, the goal here is to get to the primary cause. You treat the cause. You don't need medicine. Majority of my patients do have medicines, but only for a fixed period of time. You need to get to the cause. Yes, some people may have experienced just having symptom relief. That's not nearly enough. Now, the thing with all alternative medicine is that, is it good, is it bad? A lot of times you don't know because there are no studies done, no adequate studies done. Now, could it be causing harm? You don't know. Could it be doing good? Don't know. Could it just be that coincidental a person got better? You don't know because there's no studies done, and that's the problem they always face. But colonics, like I said, no. I don't think you would find a gastroenterologist that would agree to say, have a coffee enema and you feel better. No.
Okay, before we get into transnasal, let's talk about fasting during Ramadan. Okay?
Sure, yeah.
A lot of people, they do not complain. I mean, it's that time of the year where they do it with sincerity. They want to go through that month, come hell or high water. They need to get it done. They need to fast.
Yeah.
Some people have to suffer in silence.
Yeah.
And with fasting, what are the do's and don'ts? And I guess, how do you fast the right way? Is that even a relevant question?
Yes. Well, it's not a right way. There's a lot of new work being done about fasting, particularly intermittent fasting and things like that. But if you just talk about fasting itself, the first thing is that you're going to have to get through a period of time without any food. You don't want to be hungry because that's going to cause you problems. So you're going to need foods that are going to be broken down slowly. Things like oats, as I said before, are slow release.
So if you wake up at 5 in the morning for your sahur, what do you eat that can, last you? I can manage your levels of energy throughout the day.
Yeah, there's a lot of things. I always favor oats, bananas, fruits, and things like that. Things that are not overly processed, things that are not broken down. If you had to pick oats, go for rolled oats rather than instant oats, because your body breaks it down wrong in slow release rather than going for pure white rice, which you feel great, or sugar, you feel great for a while, and then you're starving, simply because how the body processes it, drops it down. Now you're feeling even more hungry than ever. The other side of it, when you break your fast, the idea is not to suddenly eat everything you can see. It's small, regular meals. Taper it out. Your body adapts to it.
What about sugar? Putting in, having a really sweet drink.
Well, if you have diabetes, it's a bad idea. But otherwise, what will happen when you have sugar? Your glucose levels goes up. Your body recognizes that as abnormal. Insulin goes up. The problem with it is that insulin goes up slowly. And though your sugar is now normal, the insulin is still coming down, and now your blood sugar is low. And what happens then? You want more sugar, and the cycle repeats.
Right.
So you want to avoid those things that causes sugar spikes. Now, oddly enough, even though dates are nice and sweet, they don't cause a sugar spike. So fruits.
So dates don't cause you sugar spike.
No, they don't. They don't because the idea is with fruits as well, and dates are nice and sweet as well. It's not direct sugar that your body absorbs straight away. It's within the fruit, the fibers. It's released slowly. So you can have fruits and not have a sugar spike.
Right.
But of course, if you have oranges and you have gastritis, you're going to run into trouble. But so it's different between having orange juice and eating an orange, and apple juice and eating an apple. Dates, you squeeze everything out of it, is far different from actually eating the dates itself.
Right. I'd like to take this further afield because of your speciality in hepatology.
Yeah.
Let's talk about the gallbladder and the liver.
Yes.
Now they say if you eat too much fried foods during the fasting month, or just even without the fasting month being here, a lot of us tend to eat a lot of fried foods. We love fried foods being Asian. Now, how does that affect the liver? They say fried foods very bad for the liver.
Okay, well, it's not fried only. Basically, the trouble that the whole world is having now is something called non-alcohol fatty liver disease. Everybody's getting obese and things like this, and the three main reasons why you get this is your body fat on board. Your natural fat causes inflammation in the liver, the fats that you consume, and also the sugars. can lead to more fat accumulation. Now, it's not just the fried stuff that causes problems. Because you got gallstones, then the fried stuff is a different story altogether. But what happens with this thing is you get a fatty liver. You get what is known as a metabolic syndrome, where it affects your heart, increases your chance of heart disease, cancers, liver disease, so on.
Basically, it's all the bad things.
Very much, yeah. Because you're going to accumulate fat, and the fat is inflammation.
Okay, so it's very telling that if you have a pain in the center of your abdomen, it is a classic symptom of gastritis.
Yes.
Or it's a little higher, it's good. Now, if you have a problem with your liver, or if you have a gallbladder problem, what kind of signs and symptoms will show?
Okay.
Especially during this time, sometimes we say, when we book up puasa, we eat a little bit and then we graduate. Sometimes you just want to eat. You're with your friends, you're having a good time. And you get pains. So you get pains on this side, upper quadrant, lower quadrant. What is telling of a weak gallbladder or a gallbladder that's becoming sick?
Well, the location is helpful, but never you should say, stomach's here, gallbladder here, hence this is the problem. No, you should never do that. Primarily, stomach problems tends to be more burning. Gallbladder problems tend to be more a cramping kind of nature. Gallbladder problems tend to either go to the shoulder tip or go around to the back. Stomach never does. It usually sits in the same place and goes up. That's just a very simplistic way of looking at it. I mean, you have your pancreas there, your colon's there as well, and they can all present in different ways. We've had many patients even present with appendicitis, and they thought it was gastritis.
Right.
So, don't. If you have pains, go and see a doctor. Don't try to self-diagnose. That's quite a dangerous thing to do.
Okay, I guess what we're going to do is take another break. When we come back from this break, Dr. Prabhjot is going to give us some tips as to how we can deal with different things during the fasting month. Also, when we come back from the break, we're going to find out what a transnasal scope is. Apparently, this dude is one of the best in the country. I don't know. We'll find out what is a transnasal scope. We've all had a scope done before. They put something through your throat, your esophagus. They go down and find out what's happening in there. Now there's a transnasal scope. Sounds very funky. Let's find out what it's all about. Stay with us right here on The Nation.
Hai, saya Watson Sim, berenang kebangsaan. Disebabkan COVID-19, saya tidak dapat berlatih. Tapi saya gembira kerana tidak lama lagi kita akan dapat vaksin. Namun saya terdengar ada juga yang takutkan vaksin. Jangan percaya kabar angin. Dengarlah nasihat pakar kesihatan. Vaksin bukan sahaja untuk diri kita, tetapi untuk yang tersayang. Lindung diri, lindung semua.
Thank you for staying with us right here on The Nation. We're talking about gastro problems during Ramadan, and we're also talking about everything surrounding gastroenterology. And joining me is Dr. Prabhjot Singh Sidhu. And we did promise that we're going to talk about transnasal scope. Well, what is this? It's a new thing. Not many doctors are doing it. It's slowly gaining traction, I think. But essentially, what is all this?
Well, firstly, it's nothing new. It's been around for a long time. It's just not been practiced very much. I think because it's...
Why?
It's a bit more fiddly for the doctor to do. The scopes are smaller and it's harder to control. But it's worth it. For a simple reason, patient is far more comfortable.
Okay, what happens? Do you sedate me? Okay. With a normal scope, they're going to put something down my throat. So they sedate me first. They put me on my side, I think. And then they
have to
shove
down.
me.
So what effectively happens? A gastroscope is when you go around the top. It's a quick 4-minute test. But the way to get into your stomach, which is most of the time what we're interested in, go through the mouth. But when you hit the back, you get a gag reflex. And a gag reflex you have very little control of. It sounds really bad, really horrible. Patient doesn't like it. They feel like they're choking. And so to keep that at bay, we give some sedation to calm you down and stuff like that. Now, that means medicines, and sometimes medicines can be very strong, and then you have a longer recovery period, and dizzy all day and things like that. So hence, a transnasal scope. What's the difference? Effectively, is a scope that goes through the nose. Now, I know what you're thinking. The nose is, oh my God, it's going to hurt.
It's horrible, man. I've been to an ENT. It's horrible. Getting something stuck up your nose.
Yeah, but we're not ENT.
Up and down through your nose.
we're not ENT. Effectively, we spray some solution to your nose, which numbs it and opens up the passage.
Excuse me, did you say something about ENTs?
Yeah, we're not ENT. We're going straight into the story. Okay, we're just using it as a point of entry, and that's about it.
Right.
Okay. We spray the nose, numb it, and it opens up the passageway, and the scope literally goes to the back, and a bit of pressure at the end, and straight down. No pain whatsoever. Now, your nose is sensitive. If you do get discomfort, we would not go down. That's it. And surprise, surprise, you have two nostrils. You can try the other side. Most of the time, success.
Okay,
is gained.
but how much different, or how much can you learn from a transnasal scope as opposed to a gastroscope?
I'll put it this way. If you had something down your throat, you can't speak, you can't talk, you can't do anything, you're sort of at the mercy of whoever's doing the scope. While you do a transnasal scope, you could sing if you wanted to. You do not even need sedation if you don't want to. The best thing I find about it is that patients always want to know what's the cause of the problem. We give you a CD at the end, do you look at it? Probably not. We give you a report, do you understand it? Hopefully, that we explained it enough. But what better than to see what's going on in your stomach real time as we do it? And most of the time people say, oh God, I don't want to know. But inevitably when they're there, they are actually looking and they understand. Oh, I've got redness there. Oh, I've got an ulcer. That's why I've got the pain. And that bit is two things. One is it relaxes patients down, hence no need of medicine. Secondly, educationally, it is fantastic. They understand what is wrong. They understand what their behavior, if that was the cause, had led to. It's not just the doctor says you've got this, hence you got this. You've seen it for yourself.
Right.
And that is invaluable.
Okay, so with a transnasal scope, are we looking at fasting? Do we need to fast before the scope?
Yeah.
What's the...
It's all the same. It's same like a normal
pre-production prep, as we call it.
Well, no. Effectively, no food for 6 hours, no drinks for 4 hours, or a variation of that. And then you come in, you can have it lying down or sat up, depending on the center. You can have sedation or not, it's up to you. Most of the time people don't, but we do spray the nose and numb it. And any numbness that you feel down the throat only lasts for 30 minutes.
Right.
And throughout the test, you can ask questions as we go.
Okay, I guess the $1,000,000 question then is with a transnasal scope as opposed to a gastroscope. Gastroscope is bigger. It looks like a fire hose. This I think is much
it's smaller than a pen.
Yes.
That's not a pen.
Yeah, that's not.
No, that's not a pen. Yeah.
I know it's not a pen. It's embarrassing. But having said that, will this in time bring down the cost of doing scopes?
Well, currently it's exactly the same price. So if there's no price difference, why would you take something that's less comfortable?
Right.
And something that's going to keep you there and you'll be sedated and having a groggy time, your whole day is wasted. You come in, have the scope, you can get on with the rest of the day. You can go to your friend's birthday party at night if you wanted to and do whatever you want.
Right.
Why would you pick something less comfortable over something that is? I don't know if it's going to bring down the price and things. That's not really dependent onto us. But what we can say across the board is that it's the same price.
So it's the month of Ramadan, and you're basically a gastroenterologist, you're a hepatologist, and you're also an internal medicine specialist. Just so we get it right here, his work is to prevent, diagnose, and treat internal diseases, whilst as a hepatologist, he needs to look after your liver, gallbladder, biliary tree. Can you explain that to us, and your pancreas?
Well, look, I deal with everything in this area here. Biliary tree is basically the tubings that are within your liver. It's just like literally looks like a tree, branches of a tree, and where everything drains out, your enzymes, your bile, and so on and so forth. So my job involves pretty much everything in this region.
Okay, so now going back to Ramadan and tying it all in together, now do you have tips for us as to how to manage your weight during Ramadan? I know some of us are meant to be eating less, but some of us in the spirit of Ramadan, you meet friends and family, and hey, sometimes you just have to go out there and let your hair down. Not that I know how to do it, but
Okay, well, two things. One is that I'll tell you about what to do with your friends in a second, but it goes back to what I said at the start. You want slow release food. Things that are going to keep you
slow release food, huh?
Yeah. So as whole as possible, not processed, not broken down, not in a can. Buy a fruit, eat the whole food, and things. It works fantastic. During the fasting time, it's great because you're fasting. You're getting less calories in anyway, which is great. When you break fast, this is the simplest thing to do, and it is very cultural actually. If you got 10 things to eat, you're there with your friends. Eat the fruits and the vegetables first. Now, the reason for this is you feel full when your stomach stretches. Fruits and vegetables take some volume. This amount of vegetables has the same calories as that much of oil. So if you eat all this first, then you can do whatever you want. You can eat all chicken, whatever you want to do, eat all the rice. You just simply won't because you're full.
This is not making any sense to me because as soon as we eat, I need to whack 10 satays first.
Yes.
And then move down the line.
That's fine because I love satay too and I'll probably do the same. But I give you example. This is something you can try tonight itself, whether you're fasting or not. Before you eat your meal, eat an apple. That's it. Just eat an apple and then ask yourself.
Green, red, does it make a difference?
Doesn't matter, what size. An apple's an apple, okay? Now you eat an apple, I can almost 100% tell you is that you're going to feel full before you finish your meal.
Right.
And that's just an apple. It's nothing special about apple. It's a fruit. Now if you apply more fruit and veg before you eat your meal, you can eat as much as you want.
Okay, what's the science behind it?
The science of an apple?
Of eating an apple and, and feeling satiated before.
Yeah, an apple, the way it works is one, it forms a gel. Okay, it sits in the stomach longer. It also binds with other things that comes in, greasy stuff, and because there's less surface area to touch for absorption, your oil absorption, your calorie absorption is reduced. The apple is also fantastic. They've got this thing called an ileal break, which is the end of your small bowel. Because it takes so long time to go there, you even feel full at your next meal. And that's an apple. Never mind what other things can do. So just try it tonight. Just have an apple before you have your dinner.
Right.
I'm almost 100% certain you will feel full before dinner. You may finish your dinner just out of, just to prove me wrong, but you will feel full. And apple doesn't.
Right.
It's nothing.
Well, I'm a typical Malaysian and I always believe in ubat. We need our medicines.
Yeah.
Unfortunately, we don't have time to talk about gastric or GERD medications today, one of my favorite subjects. But we'll end with an apple a day. Your message to all Malaysians during the fasting month and about gut health before we go.
I say one line I would say to everyone, it's nothing to do with apple, I would just say, and this will do good for all of us, is eat more plants. Now remember, I'm not saying fruit and veg, I'm saying plants, have more plants. Don't kill it by deep frying it, don't add all the sugar, just eat more plants. It will reduce your risk of heart disease, cancers, diabetes, I'll help you lose weight, etc. We can talk about this another time, but just eat more plants.
Right. On that note, thank you very much for being here.
Thank you for having me.
It was great to have Dr. Prabhjot Singh, who is a consultant gastroenterologist, hepatologist, and internal medicine specialist joining us during Ramadan to talk about fasting and eating the right stuff and also dealing with pain. Once again, if you don't know what transnasal scope is about and if you're not tech savvy, get someone to Google it for you. Look for transnasal scopes. There are heaps of videos out there. You can learn a lot about these scopes and how it can help you. Maybe the next time you'll be braver when the doctor says, hey, let's do a scope. On that note, I'm Gerard Ratnam signing off. Thank you very much for joining us on this edition of The Nation. Take care. Bye-bye.
Apabila keadaan darurat itu berlaku, dia satu darurat yang besar. Sepatutnya tidak ada perkara yang perlu dirisaukan. Kehidupan adalah sebagaimana biasa. Ancaman yang besar kita adalah COVID-19 yang melibatkan jangkitan yang agak mudah dan kini telah melibatkan ramai pesakit yang telah dijangkiti. Satu sajalah untuk menjaga SOP. Darurat tahun 1999 akibat selepas adanya ketegangan kaum. Selepas pilihan raya umum pada tahun tersebut, kita dapat lihat bahawa ancaman-ancaman yang memang melibatkan keselamatan dan juga nyawa. Jadi pada masa itu, darurat terpaksa diisytiharkan, parlimen terpaksa digantung. Tidak ada kerajaan dan adanya majlis gerakan negara ataupun mageran diberikan autonomi untuk mentadbir negara pada masa itu. Pada tahun 1999, adanya curfew, perintah berkurung, kita tidak boleh keluar rumah sama sekali, dan kalau kita keluar rumah memang kita terus akan ditangkap dan sebagainya, tetapi perkara tersebut tidak berlaku pada masa kini. Elemen kebebasan bergerak di dalam perlembagaan persekutuan masih ada, elemen berkaitan hak asasi manusia tersebut masih ada dalam konteks darurat tahun 2021. Satu jawatankuasa telah pun dibentuk yang mana dipengerusikan oleh mantan Ketua Kim Negara Tun Arifin Zakaria, dan jawatankuasa ini dibentuk berdasarkan kepada Ordinan Darurat 2021 dengan fungsi khusus memberi nasihat kepada ke bawah Duli Yang Maha Mulia Yang di-Pertuan Agong sama ada perlu ataupun tidak darurat ini disambung. Dan darurat ini boleh ditamatkan lebih awal, ianya boleh tamat pada